Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody, and thanks for tuning in for Direct Connection. Coming up tonight, answers to your questions about choosing a health care plan during open enrollment. But first tonight, the state could be just days away from opening its first medical marijuana dispensary. This has been legal in the District of Columbia. So to find out what to expect here, we are joined tonight by Jeff Kahn and James Kahn. They join us from the Tacoma Wellness Center. Gentlemen, thank you for being with us. Jeff, if I can start with you. By training, you are a rabbi, and now you are the proprietor of the biggest dispensary in the district. How did all this come to be?
Well, in fact, we're both rabbis, and I guess James's story is a little bit different. I was a congregational rabbi for 30 years, and really, I guess I ended up here for a couple of reasons. First of all, my father-in-law, James's grandfather, Jules Rifkin, passed away about 10 years ago, lived with multiple sclerosis for about 50 years. He tried just about everything that any of us could imagine to deal with that, and eventually was recommended cannabis, which really made a huge difference in his life. In my rabbinate, dealing with the AIDS crisis, especially in the 80s and 90s, I saw that there was a need for cannabis that could help people living and dying with AIDS at a time when nothing else was able to help them. So knowing that I could make a difference here in the district and be able to help put safe, legal cannabis in patients' hands, I was delighted to have the challenge, and we're almost 5 years old now, so I think it's we might be able to call it a great story.
Now, James, we could talk about your becoming a rabbi also, but you're also going to be opening up another dispensary in Maryland. Tell us about that.
That's correct. It's a sister dispensary to Tacoma Wellness Center. It's called Liberty. It's going to be in Rockville, right on the southern border of Rockville and North Bethesda. We're also connected to a cultivation and a processing license with that operation as well. So we're going to be able to control the product from seed to sale, or from farm to feeling, we like to say.
Well, let's talk about how the two states or jurisdictions are treating this differently. In D.C., how does it work? Who is able to walk in and buy some of your product?
Well, anybody who is a registered medical marijuana patient. And in order to do that, you must first receive a recommendation from a healthcare practitioner here in the District of Columbia, not just a physician, but perhaps a dentist or a nurse or a naturopath, and then be approved by showing that you are a district resident, be approved by the Department of Health. There are about 5,500 patients now in the District of Columbia who are visiting 5 dispensaries that are nearly 5 years old, and our program continues to grow, not quite as quickly or as healthily as the gray and black market, but our program does continue to grow.
What do you mean by the gray and black market?
Well, here in the District of Columbia, because we did pass a recreational marijuana law that's been blocked by Congress, we have kind of a strange relationship with medical marijuana delivery services and pop-up dispensaries, and a lot is being tolerated in the district that really ought not to be, and certainly wouldn't be part of any kind of regulated tax program.
All right, so you have a pretty good view of what's happening on both sides of the border. James, how does the Maryland approach differ?
The Maryland approach doesn't differ significantly, except it's been streamlined. The Maryland approach requires folks to go online to submit proof of residency or to upload their driver's license. You go to a patient registry run by the Maryland Medical Cannabis Commission. Once you've done that, you'll get a patient ID number sent to you within 48 hours. And you take that to a doctor who's also registered with the Maryland Medical Cannabis Commission, MMCC, and that doctor evaluates you to find out if cannabis could be helpful for the symptoms that you're trying to treat. And if it is, then they certify you. They provide you with a written certification and a digital certification to have access to Maryland's medical cannabis program. And that allows you to enter any of the dispensaries that will be throughout the state of Maryland. So it's relatively similar to DC, except it's online, it's much faster, and it's not captive to a single dispensary. Patients will have access to all the dispensaries in Maryland.
Very good. Let me remind our viewers, if you have a question about medical cannabis, you can give us a call. We'll have the number on the screen. You can also tweet your questions. The Twitter address is MPT News. Let's talk about the product a little bit. You have with you, just to your left, is a display of the various types of products you sell. What do people most often come in looking for?
Most often people come in looking for flower, and you can see lots of varieties of flower bud, probably about 40 or 45 that we have on hand at any time. They all differ significantly from each other with different counts of different kinds of cannabinoids and terpenoids, and we're able to, with the anecdotal information that we have, able to recommend different strains for different patients depending on what kinds of conditions they have and what kind of relief they seek. So we work very closely with patients to determine the best methods of ingestion and the best strain for them. And sometimes it varies. Sometimes it's hard to get exactly the right thing for the right person. But usually we're very successful in making the right match. One particular type of flower might be very helpful for someone with, we'll say, multiple sclerosis, like my late father-in-law. Another different one for someone dealing with radiation side effects from chemotherapy. Quite another one for someone who perhaps has trouble sleeping. Another one for someone who has trouble staying awake. Not eating, different strains for different reasons. And then besides the strains, we've got all kinds of different forms of cannabis as well.
And I think it's important to note that we have some strains of cannabis with relatively zero THC, which is the psychoactive component of cannabis. So that's the part that people associate with being high. So we have cannabis strains that do not have THC, that are high in CBD and other cannabinoids. So it is not requirement to feel that psychoactive experience to enjoy the benefits of cannabis.
Let's take a phone call. Montgomery County, this is Janet. Janet, thank you for calling. Go ahead.
Yes, I was wondering if Maryland gets any tax revenue from the sales from these centers in Maryland.
Thank you very much.
Maryland will absolutely get tax revenue from these centers. In addition, each of the licenses requires an annual fee that's paid to the state of Maryland. So the program itself actually does not cost anything for citizens who want to participate in it, but it does cost a hefty amount for the businesses that are licensed to provide cannabis and to grow it and to process it.
Let's take a call from Calvert County. This is Dwayne. Dwayne, thank you for calling. Go ahead.
I wonder if you're registered from any other dispensary, are you allowed to go to any dispensary in Maryland?
James, did you hear that?
No, I was not able to hear that.
I think it was to the point that you raised earlier about the differences between the jurisdictions. So in Maryland, somebody would get a recommendation from a practitioner, register with the state, and then could go anywhere. Is that correct?
Correct. That's absolutely correct. They do not have to select a dispensary at the time that they register in the medical cannabis program.
What's happening right now with your new store? The amount of competition, the growers, the processors. It sort of sounds like it may be organized chaos a little bit. What's happening out there?
Well, it could look like organized chaos, but actually a lot of people have put a lot of time into getting to this moment. The Maryland Medical Cannabis Commission did a lot of good homework on creating a program that was good for patients and also good for businesses, we hope. Right now in the program, the cultivators, I believe there's 15 of them, are in the middle of growing and harvesting their first round of plants. And so That is just happening right now. I can speak for Holistic Industries Liberty that we are beginning to harvest this week. So it's a really exciting time in the program. And as soon as we begin harvesting and curing the product, we're about a month away from it hitting shelves.
Let's take a call from Prince George's County. This is Gavin. Gavin, thanks for the call. Go ahead.
Hi, yeah, I'm interested in finding out if you can give me a price range and a weight range for your product.
Good question. Thank you very much.
You want to tackle that?
Sure. Here in the District of Columbia, wow, I don't have the menu in front of me, but I guess our strains run for anywhere from oftentimes less than $10 a gram to around $20 a gram. The cost gets less with weight, so if you buy an eighth or a quarter or half an ounce or an ounce, it gets progressively less expensive per gram. Tinctures are $40. Cartridges can run anywhere from $65 to $80 or $90. In the District of Columbia, it's comparable to most other jurisdictions, although we have to constantly remind ourselves that we're a very small jurisdiction. Maryland will have more patients, more providers, and chances are, in the end, lower prices.
What would you say to people who think that this is an example of the government maybe sending mixed messages on drug use and maybe sort of tacitly approving of certain drugs, maybe contributing to an atmosphere where more people are using harder drugs, including opioids?
I think, go on, James.
If anything, I think the government providing a program for patients to have access to cannabis is a firm attempt to fight the abuse of opioids. What we've seen across the board is in states that legalize medical cannabis, there is a 25 to 35% drop in deaths from overdoses. Cannabis helps folks use less opiates. For a lot of people, opiates are a terrible means of controlling chronic pain, and cannabis is a tremendous means of controlling chronic pain. The side effects are a lot less. The overall cost to the body is much more minimal. And so to me, there's a much bigger issue with the federal government. But as far as the state's concerned, this is a positive message for folks who want to see action taken with the opioid crisis in America.
Let's take a call from medication. Please, go ahead.
No. I'm just going to say a proper use of medication rather than an inappropriate one.
Very good. Let's take one more call from Howard County. This is Hovan. Thank you for calling. Go ahead.
Hi, this is Ovan from Howard County. The question I had was, is there a way for, let's say, individual investors to invest in your company?
All right. Thank you very much.
Not in Tacoma Wellness Center at the moment, but if that ever becomes a possibility, we'll get the word out.
Yeah, so I'm also not. Yeah.
Well, I was going to say the federal
Sorry,
law still makes this technically illegal, I think. Does that affect how you operate, your ability to go to the bank and so forth?
Well, it does definitely affect our ability to operate in all kinds of ways, including banking. And so we're severely restricted still because of federal laws. We're concerned because the last administration clearly was not going to enforce the federal laws against medical marijuana. We're still not clear whether this administration will try and enforce them more strictly. So we're concerned about that as well, and we really don't know.
Lastly, given that you're both rabbis by training, I have to ask, is there a Hanukkah sale, and is it called 8 Crazy Nights?
I think we're going to do it, and that's what we should call it.
It's a good idea, Jeff.
That's a great idea, Jeff. We ought to do it.
Very good, gentlemen.
Look, Hanukkah is a holiday of bringing light to dark places. And Maryland's program coming online is bringing light to a dark place. There's thousands upon thousands. I think almost 18,000 people have pre-registered in the program already, even though there's not a dispensary open. So for so many people, this program is going to bring relief from pain, and it's really a hopeful moment and an exciting moment.
And Hanukkah's about miracles and oil, and we've seen a lot of miracles happen with cannabis oil. It's really been quite amazing.
Jeff Kahn and James Kahn, thank you very much. We appreciate your time. Coming up tonight, what's new at Maryland's health insurance marketplace. We'll be right back.
Got an unused vehicle going nowhere? Donate it to the one place that can take you any place. Visit mpt.org/vehicles and support the programs you love on MPT.
The MPT app puts our programs right at your fingertips, so you can choose when to watch, what to watch, wherever you want to watch it. Download it now.
What happens in Japan and Asia matters to me. And with NHK World's newsroom in Tokyo, I get the news live from Japan right at the start of my day.
New ideas come out of Asia all the time. NHK Newsline reports on business, technology, and world events from Tokyo to Bangkok.
Once in the morning gives me a heads up on the competition.
Every hour on the hour, the news I want from Asia.
Watch NHK World now on Comcast Channel 268 and Verizon Channel 480.
Are you turning 70 and a half this year? If so, you generally have to start spending down your retirement account. Even the minimum distribution can place you in a sticky situation. Luckily, you can now use your IRA to make tax-free gifts. Gifts up to $100,000 will never count as income, but always make a difference. That's icing on the cake.
Make your gift for this year before December 31st. Visit mpt.org/support.
Joining us now in the studio is Michelle Eberly, the Chief Operating Officer for the Maryland Health Benefit Exchange. Michelle, thank you for being with us.
Thank you for having me here, Jeff.
You've just been named the new Executive Director beginning middle of December. Congratulations.
Thank you. I'm quite honored and proud to be able to be the next Executive Director for this agency with such a great mission and to lead such a great team of innovative and dedicated staff.
We're
looking forward to it.
That's great. We're in the middle of open enrollment. Mm-hmm. You know, we talk about open enrollment all the time. For people who may not know, what is open enrollment?
Open enrollment is the period given every year for folks to come into the individual market. It was established through the Affordable Care Act to come in and purchase health insurance. And it's that one opportunity, similar to if you're in Medicare and coming in once a year to get your Medicare coverage. But this is for individual insurance. And this year it runs from November 1st through December 15th.
So the clock is ticking.
It is ticking fast.
And your numbers, your early numbers have been good.
They have been. We're quite pleased. There's been a lot of, as you're well aware, a lot of discussion about the Affordable Care Act and health coverage this year. There's been changes coming out of the federal government, the administration. Not sure how that was going to affect us, but we're seeing overall our numbers are up. Our new enrollments are up 10%. Overall enrollment is up 3%, and we're having great activity with our in-person assisters, with our call center, on our website, and through our mobile app. So we're pretty excited.
Let me remind our viewers, if you have a question about open enrollment, give us a call at the number on the screen or tweet us. The Twitter address is @MPT News. So you have a couple of headwinds. You have the discussion that you mentioned on the federal level about the mandate, will that continue? And also we have some tremendous price increases that have been approved by the state insurance commissioner. We're now down to 2 providers. It doesn't seem to be hurting your numbers.
It is posing some challenges, and what we're finding this year is that folks that can avail themselves of a subsidy, they're going to be fine. So the subsidies are increasing commensurate with the increase in the premiums. So in some places in southern Maryland, in the far western regions, and the Eastern Shore, we're finding folks where they can actually get insurance coverage for less than $10 a month, which is phenomenal. And so we're encouraging people to really come back and shop and look. We do have other folks who, if they're over that 400% of federal poverty level and not eligible for tax credits, they're going to be hardest hit this year.
Who is that? Like a family of 4, what's the approximate
income? A family
income?
of 4 making $92,000 would be eligible for some tax credit. Once you get over that amount, you're really into that category where it's going to be hard for the tax credits. And those individuals are really being hurt this year. So what we're doing as an exchange is really looking beyond 2018 to 2019 and looking at how we can help drive those premium costs down, looking at what we can do to increase the number of issuers in the market, and so the types of things that we can do to help stabilize some of the premium increases.
Let's go to the phones. Allegheny County, this is Lisa. Lisa, thank you for calling. Go ahead.
Yeah, I've been here for 3 years, and I've seen my insurance go 60% up in the 3 years that I've been here. So I'm wondering, why is the state paying that much more of a premium for the exact same plan?
Okay, thank you very much. Great question. Why is it going up?
The Maryland Insurance Administration sets the rates every year. Those rates are based on the cost of care and the cost of the administration of the program. So the insurance carriers have to file that. Why those costs have been going up is that we have had a big influx of folks that never were insured before. So you have more people coming in that need more care. You also have some insurance carriers, when they went out of the gate, they underpriced their plans, and so they've had to make up for it. And things are, starting to level off depending on which carrier you speak to. That they're seeing, they've figured out that threshold that's needed to cover their costs.
Do you see any trends in terms of what people are choosing? Is it the HMO or the PPO,
right,
or the high deductible, low deductible, silver, gold, all that stuff?
The HMO plans are definitely more cost effective. What's important this year is because of the fact that President Trump did away with the paying for the cost share reductions, in the state of Maryland, we had to load those on to one of the plans, the silver plan. What that ended up resulting in is that there are some, as I said earlier, some plans that you can get for very little cost. And it may be a gold plan, so it may be a higher benefit level plan than what you have been having. So this year it's incredibly important that consumers come back, that they shop around, that they look at both carriers. We have only 2 carriers, but they look at both of them. They look at the plan, and they don't negate looking at a higher level plan because it may result in a lower out-of-pocket expense for the same dollars.
That's good advice, because people, do they get renewed automatically if they don't do anything? So you really ought to go look and see if you've ruled out the gold plan, maybe look at it anyway.
Correct. And we're seeing a lot of activity in that regard. A lot more folks coming in, changing their plans or making a change, whether it's with the same carrier in a different plan or moving to a different carrier.
Back to the phones. Anne Arundel County, this is Cass. Thank you for calling. Go ahead.
Oh, thank you so much for taking my call. I was wondering if it's through the Affordable Care Act. I have a good insurance plan through my job, but what if there's a person who has chronic illness, and that can be debilitating, and has an insurance program through their job, but it's a fairly high deductible, and then the ratio is like 40-60% in coverage after the deductible has been met? Is it possible, can those people apply for supplemental insurance?
Interesting question. Thank you very much. Can you buy one of these plans if you're already covered in some other way?
If you have coverage, the availability of coverage through your employer, you're not eligible through the Affordable Care Act unless you can demonstrate that that coverage is not affordable. So if it is more affordable to go through the exchange, you could do that. And there's a formula that dictates whether or not you'd be eligible. So again, if you are concerned about that or question that, go to our website, find an in-person assister, go to a broker, get someone who can help you walk through that process. This is a very nuanced situation, so you really should use one of our in-person assisters.
Running short on time, and I want to come back to how people get help, but let's squeeze in a call from Anne Arundel County. This is Dean. Dean, thank you for calling. Go ahead.
Yeah,
I am 66 years old, and I'm currently on Medicare, and I keep on getting these emails from Maryland Health Connection saying it's open enrollment and it's time to reapply, and I've been told that if I'm currently on Medicare that I do not have to go and reapply on a yearly basis to re-enroll, and I just want to find out if that's true or not.
Dean will get you an answer. Good luck. Thank you. What would you say?
Again, call one of our assisters, because there are some times where you could be on Medicare and also have a plan through our exchange, but call one of our in-person assisters or call on the phone and we'll help you out.
Okay, so best way for somebody to get help navigating what's a confusing thing. You do have some in-person.
We do. Go to marylandhealthconnection.gov, and on there you can find in-person assistance. What I highly encourage everybody to do is download our mobile app. It's easy to get, and it has a GPS locator on it, so you can select Get Help Now, and it will find the closest broker, the closest navigator. It will give you all the numbers you need, and that's free to download.
And same deal if you buy it from you or the broker.
There's no cost to the consumer.
Very good. Michelle Eberly of the Maryland Health Benefit Exchange, thank you for being here.
Thank you for having me.
And thank you for joining us for Direct Connection. We're back Thursday with Your Money in Business. Have a good night.
This program was made by MPT to serve all of our diverse communities.